Think you may have gout? What if it's something more serious? Something that could cause permanent joint damage if missed. Let's break it down. Hello, this is Dr. Tambar from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're diving into a real case that shows how easy it is to misdiagnose joint pain and why it matters. A 31-year-old man came in with a swollen, painful toe. He was told it's probably gout, but there's more to the story. If you or someone you know has joint pain, especially if you've been told it's just gout, this is a video you do not want to miss. So here's the case. A 31-year-old man comes into the clinic with pain and swelling in his right big toe joint, the first metatarsophalangeal joint. It's been going on for 2 months. He first saw an urgent care doctor who told him it was probably gout based on his clinical presentation and gave him some anti-inflammatory medications. But he's still in pain, and that's the first red flag. Let's be fair, on the surface, it looked like it could be gout. He's a younger guy eating a carnivore heavy diet for 6 months, which is very high in purines. That can raise his uric acid levels and trigger gout flares. Gout often hits the big toe joint first as well, so it's classic stuff. But here's the problem, it didn't get better with treatment. So I started asking more questions and doing a full physical examination, and that's where things get interesting. I notice a rash on his elbows, classic psoriatic rash. I ask, and he tells me he's had psoriasis for years, but it's been well controlled, so he didn't think it was relevant. But it is actually very relevant. Psoriasis is a chronic autoimmune skin condition that causes raised red scaly patches. The immune system, which is meant to protect you from infections, in autoimmune conditions, the immune system attacks the body instead. In psoriasis, the immune system attacks the skin. And most people think it's just a skin issue, but up to 30% of people with psoriasis develop a related joint condition called psoriatic arthritis. Psoriatic arthritis can show up years after the skin condition starts, and it doesn't always look dramatic. It can start with just one joint. Psoriatic arthritis is an inflammatory arthritis. That means the immune system is attacking the joints, causing pain, swelling, and stiffness. It's different from wear and tear arthritis, like osteoarthritis. It can be destructive if not treated. The tricky part is that early psoriatic arthritis can look a lot like gout or even other types of arthritis. That's why history and physical exam can be so important. In this young man's case, now we're thinking about two main possibilities. Number one is gout, which is a crystal arthritis from high uric acid, and the other is psoriatic arthritis, an inflammatory autoimmune condition. Both can cause toe pain and swelling, but the treatment path long-term is completely different for these two diagnoses. That's why getting the right diagnosis is critical right from the start. The next step in his workup is some additional testing. We checked his uric acid level. His level is 7.1. That's considered borderline or minimally elevated, but it's not very high or impressive. And that's not really enough to confirm a diagnosis of gout. We also checked his inflammatory arthritis labs, including his rheumatoid factor, anti-CCP antibody, and HAB27 test. All of these are negative, which is common in psoriatic arthritis. We also do an ultrasound of the toe joint. It shows a small joint effusion, meaning some fluid buildup consistent with inflammatory arthritis. But still, nothing quite definitive in terms of whether it's gout or psoriatic arthritis. To confirm gout, you need to see uric acid crystals in the joint. That means doing a joint aspiration, taking a small sample of fluid from the joint with a needle. It's a simple procedure, but incredibly important here. If we see crystals, classic gouty crystals, it's gout. We've confirmed that diagnosis. If we don't see the crystals, we'll think it's more likely psoriatic arthritis in this individual's case. That's the gold standard for diagnosis here. If we try to treat psoriatic arthritis like it's gout, we're missing the root issue. Gout is managed with diet and uric acid lowering medications. Psoriatic arthritis requires medications that work on the immune system, drugs that calm down the immune system. If left untreated, psoriatic arthritis can destroy the joint, cause deformities, and reduce overall quality of life. Early treatment here can stop the damage. The wrong treatment in this case could lead to progressive inflammation, pain, disability, and permanent joint damage. So getting the diagnosis right at this stage is critical. In this case, we did the joint aspiration, no uric acid crystals were found. The diagnosis is most likely psoriatic arthritis here. We start him on appropriate treatment for psoriatic arthritis, and within weeks his toe improves, his skin improves, his overall quality of life starts climbing. That's the power of getting the diagnosis correct. Now let's discuss some common questions I receive in this sort of scenario. Number one is, can somebody have both gout and psoriatic arthritis at the same time? The answer is yes, it's rare, but it is possible. Some people can have overlapping conditions. That's why you need a rheumatologist to look at the whole picture. And if someone does have both of the diagnoses, they need to treat them both in order to get optimal control of their overall inflammatory arthritis. Question two is, if someone has psoriasis but no joint pain, should they be worried? Well, as I mentioned, about 30% of people with psoriasis will get psoriatic arthritis. So should you be worried? Not necessarily worried, but you should keep an eye out. Early psoriatic arthritis symptoms can be subtle. It can include morning stiffness, finger swelling, or fatigue. Next question is, can psoriatic arthritis go away on its own? It's unlikely. Psoriatic arthritis tends to progress without treatment, so early treatment can prevent joint damage and help you stay active and pain-free long-term. Joint pain isn't always what it seems. Gout is common, but if it's not responding to treatment, think again. Especially if you have a history of psoriasis, psoriatic arthritis can sneak up on you, but with the right approach, you can get it under control and live well. Don't ignore lingering joint pain. Get it checked out properly. If you found this helpful, make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. If you're struggling with joint pain, skin issues, or uncertain diagnoses, we're here to help out. Give us a call or book a consultation. See you next time and live well.